Hello, you're welcome again to the channel. And today I'm going to talk to you about something very, very important. It's a common emergency among every age group, whether it is a baby, a child, or adult. So as you can see on the board, that common emergency is called choking. So I have a choking tree, which is a visualization that is meant to make it easier to understand the type of choking and as well as different conditions of the patient and what to do. Okay, so as you can see, there are two broad categories of choking. So mild choking and severe choking. Okay. So mild choking is as a result of partial airway blockage. Okay, so generally choking happens when a foreign object goes the wrong way. Okay, usually when you eat, when you drink, it's supposed to go to the GI system, which is toward the stomach. But if that doesn't happen, and then the object goes toward the lungs, then the person will have choking. So if it is partial, so in other words, the airway is not completely blocked, so the person will have mild choking. Usually there's a loud cough. Okay, loud cough is usually present in this type of choking. So if you are eating or anybody is eating and all of a sudden the person begins to cough spontaneously, so that person is choking at that time. But because there is a loud cough, it is mild choking. So what do you do when somebody is having this type of emergency? So number one, you encourage that person to keep on coughing, because this cough is important because it is actually what expels the object from the airway. And then at the same time, you monitor the patient ABC, airway breathing circulation. So ABC means airway breathing circulation. So encourage the person to keep on coughing and monitor the ABC. So that's all we can talk about mild choking. So again, it doesn't matter the age, whether it is a baby, a child, or an adult, you do exactly the same thing. Alright, so we are moving to the other branch, and which is severe choking. Severe choking is a very serious, deadly type of choking resulting from airway that is completely blocked by a foreign object. Okay, so initially there are two states here from this. The person could be conscious or the person may be unconscious. Okay, so but initially the person will be conscious because at the initial time the person still have enough oxygen in the blood, and that oxygen may be able to carry this person for some time. Okay, so but as time goes on, the oxygen in circulation will be depleting, will be reducing until it gets to a point where it is no longer enough to carry the person, and that person will go unconscious. So let us see what happens here. So when the person is unconscious, and the baby, so this person is a baby and that baby is severely choking but still conscious. So what do you do? Okay, of course you get permission from the guardian, or if nobody is there, hopefully not, you use implied consent. So So you carry the baby, and then on your hand face down, and you give 5 back blows between the shoulder blades, followed by 5 chest thrusts. Okay, so you keep on alternating 5 back blows between the shoulder blades, 5 chest thrusts, until hopefully the object will pop out. Or if this object does not pop out, this baby may go unconscious. Alright, and soon I'm going to tell you what happens when somebody goes unconscious. So let's see what happens if this person is a child or adult. So you use the same technique. So the assumption here is that this person, because the person is still conscious, the person is standing. Here, this is a baby, the baby is not standing. So what do you do here? Get consent, get consent. The person will not talk. Usually when somebody is severely choking because of total blockage of the airway, the person will not be able to talk. So when you say, are you choking, the person will just nod, okay? I'm telling you, yes, I am choking, I cannot talk. And is it okay if I help you? The person may nod like this, and then you give 5 back blows between the person's shoulder blades. Okay, so remember, this is very important, between the shoulder blades. Then after the 5 back blows, if the object does not pop out and the person is still conscious, then you give 5 abdominal or chest thrust, depending on the size of the patient. Okay, if the patient is very huge or maybe visibly or obviously pregnant, your hand cannot go around, you can actually do it on the chest. So again, alternate 5 back blows, 5 abdominal thrust, or 5 chest thrust, depending on the size. Keep on alternating until the object goes away. The object may pop out, okay, or the patient becomes unconscious, which will happen. It will happen with time. Okay, hopefully before that happens, the object is already out, which is good, and the person will resume breathing normally. But let us see what happens if this person is not relieved. You have tried all you could, and the time is running out, because with any passage of time, this person will be, heading toward unconsciousness, which is not very good. Okay, but let's assume that either this baby you are helping, or the child or adult you try to help while the person is still conscious, nothing happened. The person runs out of luck. Okay, the person goes unconscious. So what do? You lower the patient on a hard and firm surface. Then you call 911 or your local emergency number, and then you switch to CPR. Okay, so remember the two basic conditions for CPR is that the person is unconscious and not breathing, and those two conditions are met here. Here, this person is not breathing, now unconsciousness is there, so you start CPR, which is 30 chest compressions followed by 2 breaths. But before you give 2 breaths, check the mouth, because there's a possibility the object may be coming out. Okay, so before you give 2 breaths, check the mouth. If you see the object, carefully and gently scoop it out, but don't do this blindly. So if you don't see, don't try. Okay, keep on doing that. Hopefully the EMS will arrive and take over soon. So thank you so much. So I believe that with this choking 3, you know what to do when emergency happens. So again, I want you to subscribe. I have more video coming. Thank you, and I'll see you.